Welcome to the Sustainable Retail Summit Expert Series. I'm delighted to speak to Sarah Rawson today, who's a Senior Strategist, Corporate Responsibility and Sustainability at Olam International. Thank you for joining me, Sarah.
Thank you. Happy to be here.
So this episode will focus on the role of nutrition for sustainable development. And I wonder, could you tell us a bit more about Olam's systematic approach to nutrition in the supply chains?
Yes. So let me just say a little bit about Olam International. We are a global food and agribusiness supplying food, feed, and fiber to more than 25,000 customers around the world. And our value chain spans 60 countries and involves farming, processing, distribution operations, and a sourcing network of around 5 million farmers. So for us, nutrition has increasingly become a higher priority. And this is for a few reasons. The first one is that we've shifted over the years to more and more food products. So this makes nutrition a natural area of work for us. The second is that we have long recognized that good health and well-being is vital, not only for the obvious social benefits and poverty reduction, but also because of its positive correlation with productivity. And so since 2011, we've run annual initiatives under what we call the Olam Healthy Living Program, in which our businesses identify and address the risks and opportunities related to people's health in their supply chain. So these initiatives focus on things like improving access to clean water, for example, by building rural water infrastructure. But when you think about the determinants of health, really the role of nutrition is non-negotiable. We know that poor diets are linked to 1 in 5 deaths today. So if we really want to affect meaningful change for people's well-being and health overall, and in turn their productivity, we have to think about nutrition and people's ability to access and afford a healthy diet. And the third reason is really COVID-19. We know that undernourished people in general have lower immunity and are more susceptible to disease. And then at the same time, research is showing that people with type 2 diabetes or who are obese are actually at a greater risk of severe illness from COVID-19. So this pandemic reminds us that nutrition is key to health and that both health and nutrition are key for economic resilience. So at Olam, our approach to nutrition really has 2 prongs. One is focused on our consumer products, for example, the fortification of staple foods in West Africa. And the second one is, the subject of our conversation today. It's about the people in our workplace and at all levels of the supply chain. We know that malnutrition is present in one form or another in every country, and it's affecting people everywhere. So this kind of universal challenge requires a universal response with action from all sectors and different stakeholders, and the private sector has a key role to play. And I think for many private sector companies, especially if they're not in the direct business of a health or nutrition product, the role might not be so obvious. But the reality is that supporting nutrition of people at all steps throughout the supply chain is really a huge opportunity. And there's 2 reasons for this. The first is really based on the evidence, which shows that healthier diets not only boost the immune system, but that access to healthy food and good nutrition raises the productivity, morale, energy of employees, and this brings so many benefits to the company. In fact, earlier this year, the Chatham House issued this report, which for the first time showed the financial impact of malnutrition for the private sector that are operating in low and middle income countries. And what they essentially did was cost the additional output that would be possible if the labor force in all of the different private sectors considered were completely well nourished. And the report found that malnutrition is costing business as much as $850 billion a year in lost productivity. And for us, this is so important because much of this cost is borne by the agriculture sector, given the labor intensity of farming. So I know we hear so many big figures and it's hard to make sense of really how enormous it is, but to give you a sense of the scale, this is about 8 times the annual retail market value of the entire chocolate industry. So the financial opportunity to capture more of this potential productivity is very compelling reason for all businesses to support workforce nutrition. And it's not only about doing something today in your canteen or supporting, let's say, a nutrition education session for your workforce, but you also have to think a little bit long term, because if we're serious about solving malnutrition, we have to recognize that a good part of the challenge can only be solved by preventing childhood stunting. And this is because the cognitive and physical consequences of stunting are largely irreversible and stick with children throughout their entire lives. So if you're a business that wants to efficiently run for the next 15, 20, 50 years and beyond, helping to prevent malnutrition for children in the communities where you operate is really a down payment on future productivity. So we need to think about the people now in our workforce, but also take this broader perspective about how are we interacting with the communities where we operate, and how do we kind of plan for the future. And the other point I'd like to make is that if this financial opportunity isn't reason enough, improving nutrition is just so important to make progress on the sustainability targets that customers and consumers are demanding and expecting of us. You know, improved nutrition provides this platform, this foundation for progress in so many other areas, in health and education, employment, and women's empowerment. And it's also critical to the climate agenda when you consider how shifting to healthier diets will limit carbon emissions as well. So if we don't make progress on nutrition, we will really fail to make progress across all of the sustainable development goals because of how nutrition impacts on so many other priority areas.
Great, thank you so much for those valuable insights. So you mentioned that nutrition is a high priority for Olam, and you focus on people in the workplace and at all levels of the supply chain. Can you maybe share some more practical examples of what you do on the ground?
Yes, happy to. So let me share some examples about what we're doing in the workplace for our direct employees, as well as how we're reaching out to the smallholder farmers in our supply chains around the world. So on the one hand, in our workplace, we're really focused on creating this conducive environment for good nutrition. And this looks really different depending on the context. For example, in Ghana, we run an annual 30-day wellness campaign for our employees. And Ghana is experiencing this rapid dietary shift, which has been met by a rise in overweight and obesity. So our 30-day campaign has a few different components. One is, promoting a health theme each day of the week. So, it's a meatless Monday or a veggie Tuesday. I think Fridays were reserved for, a special break related to stretching. Then there are components around personalized medical and diet advice for those who'd like to lose weight. And then a series of kind of fun sports activities and nutrition education sessions. So following this campaign, our HR team there started to notice a few changes, that there were lower medical costs to the companies. We saw a decline in absenteeism, and kind of the whole campaign created space for some other broader but simple changes, like adding fruit to the standard components of a canteen meal. And canteens in particular, we see as just a big opportunity to do more for nutrition in the workplace, especially if you can find a cost-neutral way of kind of redesigning your current meals to be more nutritious. So you essentially turn the same business spend, the existing money that you spend on staff welfare or spend on providing canteen meals, you turn that into better nutrition for employees. And I realize that in the midst of COVID-19, so many of us are working from home. But for industries like food processing, there's no alternative to in-person work, and these employees are especially reliant on their work continuing at this time when many are losing jobs. So we've had to be smart about how to adapt our approach to canteens. One other example I can give you is from Indonesia, where COVID-19 cases continue to rise. And in one of our cocoa processing factories, we've fully transitioned from what used to be a self-service buffet-style canteen to preset meal boxes that are individually provided to each person. And we've also rearranged the shifts so that we have more lunch sessions and substantially fewer people in the room at any one time. So these meals are provided to the workforce for free. And we see that they've even taken on a greater importance during this time. I mean, first of all, a healthy diet is part of your overall immunity, but also by providing these meals inside the work premises where we're in charge of, hygiene and the food safety conditions, we're lowering the risk of transmission that might come with workers moving in and out of the work site in the middle of the day to get food. So, I know we have so many employers have so many pressures right now about how to face this pandemic. And I think there's a big conversation around how do we build back better, right? So that if something like this ever were to happen again, we're in a better position to, face up to the consequences. And so I think it's not only about wearing masks and social distancing now, which obviously is of life-saving importance, but it's also about assuring good hand washing and hygiene practices for the long run and treating the risk factors like poor nutrition that we know are leading to these severe outcomes for COVID-19, but many other health and economic challenges overall.
Great, thank you. So those examples are specific to the workplace. Do you have any examples from the supply chain?
So for our farmer suppliers, we also run a variety of initiatives to improve nutrition. And this, again, looks quite different depending on the context. But for example, in our coffee supply chain in Uganda, we're distributing vegetable seeds and providing some trainings on kitchen gardens. In Cote d'Ivoire, among cotton farmers, we provide direct support to their food crops. And then really in so many supply chains across the world, we work with different expert organizations to provide education sessions on healthy eating, food safety, and often that's done through these interactive cooking demonstrations. And now during COVID-19, we've also seen kind of the exceptional need to provide some direct food assistance in hard-hit supply chains so that farmers can continue to make ends meet and provide food for their families despite the market disruptions and movement restrictions in so many places around the world. Especially in supply chains, we find that partnerships are just so critical because we're not experts in health and nutrition, especially in the types of interventions that are a little bit further away from the agricultural space. So one example of this is from our cashew business in Cote d'Ivoire, where we recently partnered with the government's National Nutrition Program and their partners like UNICEF and Helen Keller International to support the distribution of vitamin A supplementation and deworming tablets to children under 5, as well as screening for acute malnutrition. And in the areas where we work, where our cashew farmers live in the country, we helped reach out to 2.5 million children with this support. And I think this is a really great example of how any type of private sector partner, even if you're not in the core business of health and nutrition, can step up. The partners provided the expertise and the supplies, while our field extension network helped mobilize communities, ensure that people were aware of this free support, why it's important, how they can access it, and then helped in the actual distribution. So as private sector, we don't need to have all the answers, and we certainly don't have them. And we don't have to spend a lot of money, but we can leverage our strengths like a large extension footprint or relationships with communities to then work with partners and increase our impact.
Right, so thank you for sharing such concrete and inspiring examples. But my question is, how do you measure them? Could you explain maybe how you set nutrition KPIs across your organization?
So to set KPIs, or key performance indicators, we consider a few different things. I would say the first one is that we're looking at the SDGs and what they track for nutrition, as well as what other leading actors have identified as the metrics that matter for nutrition. For example, we know that dietary diversity is essential for good nutrition, and there are a variety of vetted indicators that measure this. So that's one. A second one is looking at what the industry is being asked to do on nutrition, be it from platforms like your own with GAIN, the Workforce Nutrition Alliance, or from the increasingly health-conscious consumer. This provides us a good indication of the things we should be tracking. And lastly, we need to consider context and the different risk factors that exist in the places that we work. Obviously, the nutrition priorities and therefore the indicators will be very different for a supply chain in Tanzania as compared to a work site in the United States. So, taking these various sources of information together, we've identified metrics that are mostly related to scale in terms of the number of people we can reach out to with different programs that we can report on globally. And I think that while we'd like to and hope to one day really report on impact at this global level, it's challenging to collect the data required to do so with really the necessary rigor for tens of thousands of people in our supply chain. And then at the same time, there are other partners, notably governments that do this type of outcome level reporting. And so if our programs are effective, we should help progressively move the needle on these outcome metrics where we work. But there's certainly still scope to report on these metrics of change, let's say, real improvements in nutrition status. And those are really coming at a project level. So we have, let's say what we call a menu of metrics. And these are there to measure the outcomes of specific initiatives with nutrition objectives so that where we have the capacity to carry out these surveys, we can track and report on globally recognized indicators. So these include SDG indicators like the percentage of people who have access or use safely managed drinking water services, or the minimum acceptable diet for children between 6 and 23 months old, because we know that that indicator has been shown to correlate with reducing the prevalence of stunting. So where we can collect these indicators, we want to collect ones that have been vetted in terms of being scientifically valid, and that also can help in some comparison and benchmarking across different stakeholders' actions.
Thank you. So lots of different ways to measure outcomes. You previously mentioned nutrition is a high priority for Olam. Can you tell us more about the commitment of your CEO on this topic?
Yeah, so really our work on the ground has been supported at the highest level in Olam. Our CEO, Sunny Verghese, is incredibly passionate about our corporate purpose, which is to reimagine global agriculture and food systems. And to get there, nutrition and health is just one of 10 sustainability topics that we've identified as material. So this, strategic positioning at the top creates space for action and positive change all the way throughout the organization. Sunny has personally spoken about food security and nutrition as key areas for private sector action over the last few years in many public forums. And it was actually an interview I watched where he started to speak about childhood stunting that inspired me to come work for Olam. I had never seen a business leader so succinctly connect the dots between nutrition, long-term business viability, and broader prosperity. So it's really that leadership that creates a lot of inspiration and action by all of us in the company.
Great, thank you. At the Consumer Goods Forum, we believe the workplace is an optimal point of intervention to contribute to the improved health and well-being of individuals. And through the Workforce Nutrition Alliance, which you mentioned, which was co-founded by the CGF and the Global Alliance for Improved Nutrition Gain, organizations such as Olam are coming together to support employers to adopt workforce nutrition programs. Can you tell me how it works for Olam and how you engage and get buy-in across your organization?
Yeah, so important. So at Olam, I can say that the nutrition agenda is really co-led by the business units themselves, and then the support functions like human resources and corporate responsibility and sustainability, which is where I sit. And my role is really as a partner and advisor to business units in developing strategies to improve health and nutrition throughout the supply chain, be it in the workforce, in factories, or with farmers. And this work takes shape in many ways, from assessing risk to piloting innovations, designing programs, and perhaps most importantly, in identifying partners. But buy-in, internally with all of the different colleagues that, that contribute to making the work happen is so important for any topic. And it is difficult to say, prioritize nutrition over other priorities of equal importance and urgency. But I think there's probably two ways that for nutrition specifically, we can make headway in terms of getting buy-in in a company. And the first one is to really make it as easy as possible for people to do more on nutrition. So by this, I mean, provide the toolkits, the guidance documents, the checklists, things that simplify the work for nutrition. So for example, if you are in a role like mine and you're advocating to include, nutrition focused checks in all the health checkups that are being provided to employees, you might provide a list of all the possible checks that might be appropriate to the local HR manager, and then they can easily sit down with their partner doctor to review that list and see what makes sense. But by doing that list to begin with, you kind of remove a step of work for that colleague and make it easier for those improvements to take place in the workplace. And then the second one is really to speak about the business case and the centrality of nutrition to the overall sustainability agenda. As I was just saying before, the evidence for private sector action is just so compelling. And yet for many, it remains a somewhat obscure topic or too complicated. So I really feel that we need to demystify nutrition and communicate just how relevant it is to supply chain resilience. And when business managers see that link to their work and see how it connects to their bottom line, they join in and they see work on nutrition as part of their own.
Thank you. So you've shared a lot of valuable insights with us today. Any final comments?
Sure. I think my main message is that improving nutrition is not something that can be done by any one actor. And we are actively seeking more and new types of collaborations to increase our reach and impact. The Consumer Goods Forum and Gain's Workforce Nutrition Alliance is a great example of bringing different employers together to commit to and take action on improving nutrition for all the people in their supply chains and in their workforce. So I would just strongly recommend that other companies, support the Alliance and its ambition and join in our collective efforts to see a world that no longer has malnutrition.
Wonderful. Thank you for speaking with me today. For sessions on sustainable diets for healthy people and employee health and well-being, join us at the Sustainable Retail Summit, where speakers will share the role health plays in creating sustainable food systems and shared value for both businesses and communities.